All right, everyone. We'll go ahead and get started today. So hello and welcome to today's webinar, Medicare 101, What You Need to Know Before Making Decisions. My name is Max Kempton from Strategic Retirement Partners. We appreciate you joining us for this special event today. A few quick notes before we do get started. All lines are muted, but we do welcome your questions. If you have one, please get out your phone and there will be QR codes at the bottom right corner of each presentation slide. That QR code will take you to an online form where you may submit a question or schedule a consultation with our team at SRP. I will monitor those questions and we'll get to as many as possible towards the end of the presentation. Also, this session is being recorded and we will share the recording with all who have registered later this week. So with that, today we're joined by Nicole Morgan, owner of Morgan Medicare Solutions. With over 20 years in healthcare, Nicole has worked across every setting from hospitals to home health and brings expert knowledge of Medicare. As a Medicare certified agent, she helps clients confidently navigate their coverage options with a personalized, client-first approach. Nicole, thank you for joining us today. And with that, I will turn it over to you.
Okay, so again, I'm enjoying being here. This is one of my favorite things to do, believe it or not, is educate about Medicare. And we have a short amount of time to cover a lot of information. And so go ahead and advance there. Next slide. What I want to tell you a little bit about Morgan Medicare Solutions. So I'm an insurance agent. I own an independent insurance agency. So I do not work for any specific carrier. I'm licensed with multiple carriers across the US. My services, I never charge a fee for my services, my consultations, my advice, and all the questions that I get every day. I don't charge a penny for that. But my primary focus in my practice as an agency is to always provide education first. And my education a lot of times comes in a class and a seminar just like this, and a lot of personalized one-on-one education so that everyone can understand their certain situation. So it's education, and then we also do plan research. So there's not a cookie cutter plan for everyone when they're on Medicare. Everything has to fit that person, that person's needs, and that person's budget in retirement. And then I also provide long-term ongoing service. So I'm available at all times during the year if anyone has any questions about their plan or they need a change or a certain situation comes up. Okay, next slide. What we're going to learn today is how and when to enroll in Medicare, which is super important. And the parts of Medicare, we'll break those down a little bit and talk about what each of those cover. We'll also want to address Medicare mistakes. We don't want to make any mistakes because with mistakes comes penalties, and we don't want that. We're going to also talk about the Medicare options. So once you have Medicare, what are the plan options that you can choose? And then also we're going to address some frequently asked questions and then how to set up a consultation through me. But you'll probably also just reach out to SRP. They are linked to me. They know how to find me, and they can connect you to me as well. So the first thing we want to talk about is how and when to enroll in Medicare. Next slide. So the first two things that I want to address is there is two important accounts that you need to set up. So if you do not have an SSA.gov account right now, you need to set one up. Just because you have an SSA.gov account set up does not mean that you are applying for Social Security income. I myself have an SSA.gov account. What does that account tell me? Well, one, it's going to tell me if I have worked my 40 quarters or 10 years in order to qualify for premium-free Part A of Medicare. And I do. It also is going to tell me, and it has a retirement estimator. So I can see what my full retirement age is and what Social Security income that I will get at whatever age that I decide to draw it. Okay, so you do want to check your Social Security earnings. It's a place that you will go to apply for Social Security at the time that you want to draw it. And it is also the way that we apply for Medicare. So most people think that you go to medicare.gov to apply for Medicare. No, you don't. You will go to Social Security and apply for Medicare there. I think the easiest way, depending on your situation, especially if you're turning 65, is to set up a Social Security account and apply there. There are other circumstances when someone is working past 65 where I will tell them they have that account, and then they will probably go to the Social Security office and drop off some forms in order to get Medicare that way. So it depends on the certain situation, but all in all, you need to have set up an SSA.gov account. This summer, they have made it pretty specific on verifying your identity, so that has changed. And so you have to take a picture of your license, you have to take a selfie. No matter how you set that account up, you have to verify your identity. Once someone has Medicare and they have a Medicare ID number, then they need to sign up for a Medicare.gov account. What can you do in this account? Well, if you have original Medicare, you can see all of your Medicare claims. If you're not getting your Medicare premiums paid and deducted out of your Social Security check, you can pay your premiums here as well. You can also store your list of medications in this account. You can also look for a new plan, mainly an Advantage and a drug plan, and shop for Medicare supplement premiums that way. But the main thing that it's used for is to keep track of your plans, either pay your premiums, keep track of your drugs, and maybe do a plan review each year. So having a Medicare ID, you'll want to set up a Medicare.gov account. All right, moving on. So when do you need to enroll? When you're turning 65, you get an initial enrollment period. You get 3 months before your 65th birthday, you get the month you turn 65, and then you get 3 months after to sign up for Medicare with no penalty. And I'm going to refer to this quite often. It depends on your situation as well, especially for all of you that plan to work past 65. Okay, some people think that they've got to sign up for Medicare when they're 65 regardless. Well, I'm going to say that it depends on your situation, especially at your job. It depends on if you are collecting or contributing actually to a health savings account. Okay, if you are contributing to a health savings account, you do not want to apply for any part of Medicare. The big myth is, oh my gosh, I'm going to get a penalty. Well, that's why it's good to do this journey with an expert to avoid all those penalties. But if you are planning to go on to Medicare when you're 65, you have this 7-month enrollment period to sign up for Medicare. Medicare will begin on the first day of the month. Okay, so if my birthday is December 29th and I apply for Medicare in the first 3 months before my birthday, my Medicare will begin on December the 1st. But if I'm born on December the 1st, that whole 7-month time frame that I get moves up by 1 month. So instead of December the 1st that my Medicare will start, it will now begin on November 1st, only if I was born on the 1st of the month. So keep that in mind for any of you that have been born on the very first day of the month. You can actually sign up for Medicare about 4 months to your birthday. Now, when you're in your Social Security account, I'm going to address that. 3 months to the day of your birthday, you will see come up in that account on your homepage in the Medicare section, start a Medicare application. Okay, so it's always 3 months to the day of your 65th birthday that link will come up. If you are collecting Social Security payments before you're 65, you will automatically, this is the only time that you will automatically be signed up for Medicare's Parts A and Part B. And that's only if you're collecting Social Security prior to the age of 65. If you decide to wait and collect Social Security after you turn 65 or at your full retirement age, then you have to sign up for Medicare. Processing on getting your Medicare number takes about 2 to 4 weeks. Another reason to have set up an SSA.gov account is because that's the account that you're going to follow up with the processing of your application. Okay, so just remember, it's going to start when you apply on the first day of your birth month, except if you were born on the 1st. Next slide. Biggest question, and the bulk of my clients are all working past 65. And the majority of you on this call may be planning to work past 65. My advice to you, if that is your plan, is to meet, even when you plan that, but you're turning 65, go ahead and meet with an expert agent on your Medicare options. Know what it is going to kind of cost you in Medicare. Compare that to what it's going to cost you in your group health. Maybe one is better than the other. Maybe it's better for you to go on to Medicare than it is your group health. It is a good idea to know your options ahead of time, okay? And if you choose to stay on your group health though, and you don't apply for Medicare, one, if that group health is credible with Medicare and they're taking that drug portion of your group health and they're comparing it to what Medicare's coverage is, if it is credible, typically a group health that's over 20 employees, actually a company that's over 20 employees, their drug coverage is typically credible with Medicare. If you want to stay on your group health beyond 65, you can do that, get on Medicare later, and have no penalty. You can sign up, I repeated this earlier, you can sign up for Part A. If you're not contributing to an HSA, you can sign up for Part A, kind of get your foot in the door, get familiar with the Social Security account online, sign up for Part A, and then decline Part B and add Part B later when you stop working or retire, okay? You will not get a penalty. You do have to provide proof, though, that you have been employed and that you have been covered by a credible group health coverage. So there are a couple of forms. Let's say someone signs up for Part A and they decline Part B later. Well, instead of applying online through your SSA.gov account, what you're probably going to do, since you already have Part A, is you're going to fill out a form. It's called the CMS 40B, and that's your Part B form. And then you're going to fill out another form, and your HR department is going to help you because they're going to sign on the bottom. It's called the Employment Request Form, and it is the CMS L564. What that little form does with that HR signature on there is wipe away any penalty. So it's proving to the government that, yes, you have had credible coverage and you do not deserve a penalty because you're getting Medicare later beyond 65. The best time to evaluate your work situation is one, maybe when you turn 65, and just to get a plan of action in place, know what to do and when. Planning for Medicare and your retirement should go hand in hand. You cannot, and you cannot do anything with Medicare. It's the government, Social Security. You cannot do anything last minute and expect it to be done overnight. It just doesn't happen that way. So you've got to give yourself ample planning time. In a perfect world, when we can plan, we plan everything typically. We need to meet with an expert at least 2 to 3 months before either your work exit date or before you turn 65. That way you have time to absorb the education, ask as many questions as you want, because there are going to be questions that come up. The whole situation has to be taken into account. Is it just you that you're covering? Are you still covering a spouse that may not be 65 yet? You may still be covering dependents. So it all has to be examined and evaluated. The best time to do it is before you turn 65, right before. Timing is everything. Planning is critical. Go ahead. Let's talk about the parts of Medicare. There are 4 parts and they all have letters. We're going to talk about Part A, which is your hospital insurance. Part B is considered your medical insurance. Part C is the Advantage Plan, otherwise known as the Medicare replacement. And then Part D is your prescription drug plan. Next slide. Part A is your hospital coverage. It only covers hospital, covers skilled nursing, home health, and hospice. It is premium free, meaning it has no premium if you qualify. And remember, you know if you qualify by having that online ssa.gov account. You can see if you have qualified. That means you've worked 10 years or 40 quarters, you've paid into those FICA taxes, those Medicare taxes. There is a first day hospital deductible. This is going to gradually creep up every year. This year in 2025, that first day hospital deductible is $1,676. It's expected to go up next year. Medicare has not really released that information, but you can probably expect maybe it's around $1,700, but that's not been announced just yet. Probably the announcement for 2026 numbers is going to be in about November timeframe. There are copays. Once you are in the hospital 60 days and beyond, you have a copay, and those can go as high as $838. Those copays gradually go up every year, okay? Nowadays people are in the hospital for a very short time. It's very rare that we see someone that's in the hospital beyond 60 days. Excuse me. Skilled nursing. Skilled nursing is not an inpatient rehab. It is a lesser rehab. It's attached to a long-term care facility. Many of you may have had family members that have been in a skilled nursing. They have copays and those go up every day. So you can stay the first 20 days, Medicare will cover that. Then after that 20 days, Medicare will give you up to 100 days of skilled nursing care, but then it's going to cost you. If you have no protection in place, no other policies to protect you, it's going to cost you $209.50 a day in 2025. I suspect that that will go up in 2026. Next slide. Part B is your medical insurance. This is all of your outpatient. This is your doctor visits, your outpatient tests, your procedures, your x-rays, your outpatient therapy. That only covers 80%. So you only get 80% on Part B that's covered. That leaves you 20% co-insurance without a limit. There's no cap on that. There is an annual deductible. It is $257 this year. It is expected to go up next year in 2026. We may see numbers around $288. Again, that hasn't been announced just yet. But this part of Medicare has a monthly premium, and it is based on your modified adjusted gross income from 2 years ago. So if you were to go on Medicare in 2025, Medicare is going to get with the IRS when you apply, and they're going to determine what your modified adjusted gross income was from 2023. And they're going to base your premiums on that. Okay. The base rate this year for Medicare Part B is $185 per month. That is based on, let's say, a joint couple, a couple that files their taxes together, whether both work or one works, they're together. And that couple from 2 years ago has to make $212,000 or less in that modified adjusted gross income. They will pay the standard rate of $185. If they have earned more and they pay higher, then they will pay more. They will pay what's called an IRMA. They will pay an income-related monthly adjustment amount. It will be added onto the standard Part B premium. Let's just call it $185 this year. It's expected to go up just over $200 next year. They'll pay an adjustment on top of that $185, and they'll pay an adjustment called the IRMA on top of whatever their drug plan premium is. That's Part D. But they're going to adjust it each year going forward but they're always going to be looking back 2 years. So in 2026, they're going to look back at 2024. Next slide. I wanted to give you a chart. I know this has a lot of information on it, but this is a snapshot. This is a chart that I break down each year. I send it to a lot of advisors, and it just makes it easy. Medicare does not make it easy to kind of determine what you're paying for your IRMA. So I kind of took what they did and just dumbed it down a little bit so it was easier for me to understand, first of all. So I know if it's easier for me, it's easier for my clients. But I've got individual tax returns listed, if you can look at this chart, and then the joint tax returns, okay? And then they're, like I said, they're looking 2 years back. So you can see on that column that says Part B plus the IRMA. So if it's, the standard rate, it's less than or equal to what the standard rate is, then you're paying the standard 185. And you're paying no additional on your Part D. But you can see how that threshold of income goes up. It goes from, let's just call that joint tax return, 212 up to 266,000. Then you're paying an additional $74 on your Part B, and then an additional $13.70 on top of your Part D. Those people that are in that column of 500,000 plus as a single and 750,000 plus as a joint tax return, they are going to pay in the ballpark of $630 for Medicare Part B. And in addition, they're going to pay an additional $85.80 for their drug plan. So if their drug plan already cost $100, they're going to pay $85.80 on top of that. All of these thresholds, all of these numbers that I'm showing you right now are about to change for 2026. I suspect that these income levels will increase. I know for a fact that the Part B standard rates are going to increase, as well as the IRMAs. So some of my high earners tend to think that it's a penalty because they've made so much, and it's not a penalty, it's an adjustment. This happened in the Bush-Obama era, where Medicare Part B premiums became a means-based premium based on your income. Next slide. Part C is what you see on TV all the time. That's the easiest way to describe this one. This is the Advantage plan. You have lots of different carriers that advertise their Advantage plan. They advertise their copays. They advertise, the benefits that you get with it. They also say you may qualify. These are the Medicare replacement plans. You have to have Medicare Part A and Part B active. You have to be paying your Medicare Part B premiums in order to get this Part C. What it does, the reason it's a Medicare replacement is because an insurance company is now handling the claims. Medicare is the mothership of it all. Medicare has to approve these plans every year. Medicare also gives rules to these insurance carriers, and these insurance carriers have to follow these rules. But in order to keep costs contained, okay, they have copays for everything. They are either HMOs or PPOs. They're very network driven. They're very county or region specific. So there's only a certain amount of plans offered in your county and offered in my county. They're not going to be the same plans. There are no national plans. There may be some national networks, but there's no national plans. They can be changed every year. Medicare says that these insurance companies cannot ask a health question. So you can change Advantage plan to Advantage plan with no health questions asked. There are 2 times of the year that you can do that. You can do that October 15th through December the 7th. We're about to start in another annual enrollment period tomorrow for all of my people that are on Advantage plans. If they want to change, this is their opportunity. They also have another opportunity January 1st through March the 31st to change their plan again. And so there are a couple of times a year that you can change the plan, but they are an all-inclusive plan and they've got to budget. Medicare subsidizes these plans, meaning Medicare budgeted a certain amount of money to give to each carrier per beneficiary per person that signs up for these plans. So they have a budgeted amount of money to manage that person's health care. So these plans are managed care. Next slide. Part D is the drug plan. Part D can be obtained through an Advantage plan. It can be obtained through a standalone plan. In fact, in the state of Texas alone, I know that we probably have multiple states that are attending this call, but in the state of Texas, there's only 12 plans. Each state has different plans that are offered. What we're seeing a trend for standalone drug plans, okay, and you can find all of these in your state on Medicare.gov. You actually don't have to have an account to look up what's available in your area on Medicare.gov. You just simply type in, you click on Find Plans, type in your zip code. You can see how many drug plans. They're also called PDPs, Prescription Drug Plan, or you can look up through the Advantage plan. Most Advantage plans have a drug plan included in them. All premiums, all deductibles, all formularies. Formularies are the list of drugs that plan will cover. With every single plan, every one of them is different. The highest deductible on a plan that was set, it's set every year by the government. The highest deductible this year is $590. Next year, the deductible has gone up to $615. You can see the trend. It's going up gradually each year. Not sure when it's going to stop. Generic medications are not a real issue at all, but brand names can be very expensive. And I didn't include this slide in here, but there are 10 diabetic and heart drug medications that got negotiated for 2026. So people on Xarelto and Eliquis and some of the high dollar insulins that are not common at all got negotiated down. So for next year, the costs are better. And I'm starting to see that just a little bit in just the drug evaluations that I'm doing right now for my clients. But a drug plan is required by Medicare. If you do not get a drug plan when you are first eligible and your health changes and you need more medication, and so it's breaking your bank to pay cash for all your drugs, and you want to get a drug plan. Well, if you've been so many years without one and then you sign up at a later date, you're going to get a penalty, and they're going to go back all the way to however many months you did not have one, and times that by 1% of whatever the national drug plan premium average is for that year, and that's going to be your penalty. And by the way, you cannot pay that off. It will follow you forever. Forever. You cannot pay that off. But it's good. You can change your drug plan each year. A lot of mine, if your health changes, it's a good time and you get more medication or less medication, it's a good time to do a review each year during the annual enrollment period. And that's starting tomorrow and it ends on December the 7th. Medicare gives you a window to change your drug plan each year. No health questions asked at all. Some people just let it rock and roll if they don't have any changes, and if the plan remains for next year, they just let it automatically renew each year. But you do have a time where you can change it. No health questions asked. Next slide. Now let's talk about, we've got your Medicare, and now let's talk about the options. So you've got your Medicare number, and so we need to choose an option to protect us so that our costs are not out of control. So the one option that we can choose is we can choose to stay with original Medicare, and that's your Medicare A, Medicare Part B, and then Part D, we take a drug plan, and then we fill in that 20% that's left over with protection of a Medigap plan. A Medigap plan works with Medicare. It is controlled by the state, and it works with Medicare and acts as a secondary to Medicare A and B. There are two very popular plans that are available. A Plan G will pay the full 20% after you pay the Medicare annual deductible on Part B, which is this year $257. Once that's paid, then that Medigap plan starts picking up the 20%, leaving you kind of like an 80-20 plan. A Plan N does the same thing. You have to pay the deductible to Medicare Part B, and then you have a copay. You share in your healthcare cost. A Plan N also has a lower premium typically than a Plan G. You pay a $20 copay at the doctor, and you pay a $50 copay at the emergency room. Those are only two copays that you have. All Medigap plans, so every Plan G that's out there on the market, the coverage is equal. All Plan Ns that are sold, the coverage is equal. There's no difference except the price that each of these companies set and probably the rate of increase, because these are mostly age-attained premiums, meaning that they're going to go up gradually each year that you get older. It doesn't cover drugs, so you have to take a standalone plan in your state to cover your prescriptions. And it doesn't provide any dental, vision, or hearing. And oftentimes we put a cancer plan on top of that as well to help us and give us extra protection for cancer. But those are extra policies that you add on top of it to make your package of protection complete. Next slide. This is what it looks like. I wanted to compare apples to apples. You can see the only difference on this chart is that the premium is different between all these companies. And these don't represent any real companies whatsoever. It's just to show you that a Plan G is a Plan G. A Plan N is a Plan N. All the coverage is the same. It's the same year after year. No change. Next slide. The Advantage plan is your second option to choose, okay? So you can choose to stay with the original, or you can choose to go and take the Advantage plan. Remember, they're private insurance plans subsidized by Medicare. It is managed care. It controls all of your healthcare costs. There's copays for everything and a max out of pocket. Now, some of these premiums for these kind of plans are as low as $0. And then they can go as high as $200. It just depends on what's offered in your area. The other thing is that they have a max out of pocket. So all the copays that you spend for your health care all add up to this max out of pocket. I have seen max out of pockets go as high as $14,000. They're not deductibles, they're max out of pocket. Typically, people meet these max out of pockets when they have catastrophic diagnosis like cancer, dialysis. They're going to be paying 20% coinsurance until they meet their max. So these Advantage plans, the insurance carriers have to follow Medicare rules. They can never ask a health questions. They have to cover what original Medicare covers, and they have to be approved every year. They're HMOs or PPOs. You have to abide by the doctor network. You have to choose doctors to keep your cost controlled. Choose a doctor that's within the network. Okay. You have to have your Medicare Part A and Part B active. And you can change them. We've already gone over this. October through December, October 15th through December, or January 1st through March the 31st. Okay. So these are very controlled plans. There's no national plans. They're just within your specific area. Next slide. They are like fruit basket turnover, really. What we're seeing next year in the trend for Advantage plans, we're seeing a lot of carriers that are pulling out of the market. They're pulling plans off the market. There are going to be less option. How it affects me is some of them are not paying commissions at all. So they're putting all the weight on the beneficiary to not use an agent like myself and to do this decision all on their own. That can get very, very overwhelming when you do that. When you are looking for an Advantage plan, it is best to know that every one of them can be different. And when I'm researching for someone and they want this particular option, I have to make sure they know what their drugs are going to cost on this plan, and they also know if their doctors are in network, because doctors can fall out of a network any time of the year. We have Advantage plan carriers negotiating with hospital systems across the US, and sometimes they don't come to an agreement. Therefore, that hospital may not take that plan. So I would say there are some risks with choosing this plan, but one carrier can have 5 different plans and all of them are different, and all of them have different doctor networks. So it's real important on this plan to do proper education if this is the option that you choose, and to do it with an expert and to make sure your doctors take it. Next slide. Deciding on a plan. It can be and feel probably overwhelming. There are a lot of moving parts to Medicare. There's a timeline you have to follow. There's a lot of research that goes into making sure that you are on the right plan for you. We talk about things about how important is it to keep your doctors. You know, some people come to me with a long list of diagnoses, and they've got to see those doctors that they told me they were seeing. So we've got to find a plan that all the doctors take, so they are not in jeopardy of having to change their doctor. We take into account where you live. Do you live somewhere rural where it's outside of a big city? Do you live in the heart of a big city? What is available to you in your area? And then we also look at your budget. This needs to be a part of your retirement planning, is your healthcare planning. You've got to not only budget for all of your finances and your bills and your cost of living and all of that, but you need to put in there the cost of what your healthcare is going to be, and expect increases in Medicare and plan ahead for it. Get with your financial advisor. SRP is an excellent resource for all of you to make sure that you know what you're going to pay, and if you have enough money to pay it now and for the future. You know, how flexible do you want your plan? You know, do you want to have to choose your doctors, or do you want doctors to be chosen for you? You know, we also take into consideration the medications that you take, a lot or a little. You know, how important are extra benefits? The Advantage plan offers the extra bells and whistles. They advertise them on TV. You know, they're out there for the open. How important are those? Do you need those to sustain life? Do you need those extra benefits? Will they benefit you? Next slide. The things, though, there are things that they don't tell you. You know, you're stuck on your own, finding out all this information on your own, or finding someone like me that exists that can walk you through this whole process, holding your hand and telling you every detail so that, you know, you're not left in the dark on any level. Okay, but there are some things that you must know that they're not going to tell you from the government of when you're preparing for Medicare. And one is that not all doctors will take Medicare. If you don't have a primary care doctor now set up before you're 65, or even when you're working, that doesn't take Medicare, you've got to find one that you can transition to. It can be hard to find a doctor that will take a new Medicare patient. So I think it's a good rule of thumb to always have a primary care doctor. It's not mandatory in most cases that you have one, especially on that Advantage plan. PPOs may not make you have a primary care doctor, but HMOs do. You have to have a primary care doctor that takes the plan. But I want to stress, it can be hard to find a doctor who will take a new Medicare patient. Most doctors will take you on as a Medicare patient if you're already established. So get established with that doctor, understand from them what kinds of Medicare plans that they do take. For those of you that may be working past 65 and retire or COBRA and be offered COBRA in your job, most of the time we're offered COBRA up to 18 months. Well, Medicare doesn't consider that credible coverage, one, because you're not working anymore. And they only give you 8 months to be on COBRA before they'll start getting you with a penalty. So worst case scenario, people that are offered COBRA and they waited till the last minute, or they just didn't have an opportunity, or their circumstances wouldn't allow them to plan. You know, we find that with our jobs sometimes. So if they have to go on 1 or 2 months of COBRA while we get everything lined up, that's okay. You're still not going to be penalized for that. But if you're on COBRA longer than 8 months, you can get a penalty, and it will follow you for life. We touched on this earlier about contributing to a health savings account. If you are contributing, let's say you're over 65 and you're contributing to an HSA, then Medicare suggests that you stop contributing to that HSA 6 months prior to applying for Medicare. The reason why is they backdate it 6 months when you apply for Medicare A and B. So that's why planning comes into play on this, especially when you are depending on that HSA. You can use your HSA funds after you get on Medicare, but you just can't contribute while you're on any part of Medicare at all. And then timing is everything. Knowing when to enroll, how to enroll can save you that penalty for life. Next slide. We want to avoid, if at all possible, every mistake that could be made. It is possible to avoid them all. We want to not miss an enrollment deadline. We don't want to miss the Medigap enrollment period. When you are first on Medicare, let's say your Medicare starts on December the 1st, you have a Medigap enrollment period. Okay, that was that secondary to Medicare that we talked about earlier. You have 6 months from December 1st to get a Medigap with no health questions asked. It's guaranteed issue. Okay. After that, if you try to get a Medigap, most likely in your state, you're going to have to be underwritten and pass health questions if that's the option that you want to have. And if you're unhealthy, they can deny you. So never miss that window. Not keeping proof of credible coverage. We talked about this, about your employer signing off on that CMS L564, that form that proves that you've been covered credibly. Well, sometimes people change jobs after they're 65 and they go from one company to the next. But make sure if you do that, you can stay on their group health if it's credible, but make sure you keep that form, CMS L564, that employment request form, signed by your previous employer, so that by the time you get to Medicare, you've got proof of coverage of all the companies you've been with since you've turned 65, so they don't stick you with a penalty. Failing to review your coverage yearly. You know, I send out 1,000 plus emails a year to my clients, reminding them to review their plan. And some people don't even do their due diligence and read what the carrier sends them in the mail. And if they fail to review it, and then they get into the next year and they've missed altogether that the premium on their plan jumped from $20 to $70, and it's after the time frame where I can change it, they're stuck with that higher premium. So it's a really good rule of thumb every year to know the process of review and if you need a review each year. Assuming that Medicare is free and covers everything. That is a big mistake. I had a client one time that was shocked that she had to pay for Medicare Part B because she'd worked all this time and she assumed that it was free. It is not free. You will have to pay for it. If you are a high earner, you will have to pay more for it. Talk to your doctors. Talk to your doctors, talk to your insurance people in the doctor's office. Ask them what kind of Medicare plans they take. Ask them what is easy for them. What is the easiest plan? They won't know carriers. They won't know names of plans, but they know the types of plans. Ask them. Me being a health provider myself back in the day, talk to them. I know what's easy for me. If I was your therapist, if I was your clinician, I know what's easy for me still to this day to get the care that you need. So really talk to the front lines of healthcare is the providers. And so talk to your doctor. Not understanding how Part B is billed. We go over this with each client. You know, are they collecting Social Security? Is it deducted from their Social Security check, or do they have to pay for it? And then, you know, work with someone that knows your situation that you can talk to and they know exactly what to do. So always work with an experienced Medicare agent. Next slide. So that is, I think we've done pretty good time, hopefully. But that's in a nutshell, the basics of Medicare. So I know that you all will have questions. They'll probably hit you later, but if you just send them to SRP, then I'm sure I can answer through them as well. So Max, I guess, are there any questions that I can answer?
Yes, there are. First of all, thank you very much for all that great information. Getting to some of the questions we got first, a little bit more about supplemental insurance. One of the question was seeing if that's something that you can help with, and they were curious on whether you have any restrictions in terms of states that you could work in.
So I'm licensed in 31 states, and that is climbing gradually thanks to SRP. So it just depends on the state. If I happen to not be licensed in your state, one, I can get licensed very, very easily, or I can refer out. I don't typically like to refer out, but I do have connections all across the US to some really good agent partners. So I would only, if I had to refer out, refer to someone that I trust with my own clients. So be very, but yes, so I help people enroll in a Medicare supplement, drug plan, or Advantage plan, and any extra necessary policy for their protection.
And then one other question about supplemental is the question came in. Our company offers a Medicare supplement plan post-retirement. If someone has a supplement plan, what parts of Medicare should they sign up for?
Okay, so you broke up a little bit. So if the company is offering a supplement plan,
Mhm.
okay, so sometimes companies, you need to kind of verify with the company. Is it a true supplement like a Plan G or a Plan N, or are they calling that Medicare Advantage a supplement? I have had companies get that terminology just wrong, and they're calling the Advantage plan a supplement, which it is not the same thing. An Advantage plan is not a supplement. So a rule of thumb is that if the company offers you a Medicare plan and there is a PPO attached to it or an HMO, those little initials, you're getting an Advantage plan. So always clarify with that company, is it a true supplement to Medicare? Is it going to pay that full 20%? Or are you going to have a max out of pocket and copays? And is it an HMO PPO? Verify, clarify, make sure you know what you're getting into before
Got
you
it.
sign the dotted line.
And then kind of sticking with that, the Advantage plan, a couple questions from that. One was, why would someone do an Advantage plan over just the traditional Medicare?
Probably initially is affordability. Some people really get caught up in the $0 premiums and then all the extras. I do have people that it fits them, and I have people that are not afraid of networks. They're not afraid of max out of pockets, but I just tell people, if you're going to choose the Advantage, you got to make sure that you've got that max out of pocket of money sitting around somewhere in case something catastrophic hits. You got to have that because you'll be paying it. So, it just always depends on the person. Kind of the supplement option, you're paying as you go for that healthcare because the premiums are higher. And then with the Advantage plan, when you get hit with sickness, catastrophic illness, you're going to get hit at one time. So you got to you just got to understand the different options. The way I approach it is how they each navigate the healthcare system.
Mm-hmm. And then
They're
do you
different.
see most people opting for that Advantage plan, or which is another question that came in?
It is one, I'm going to say this, it may depend on the agent. There are some agents that will steer people right toward the Advantage plan. I kind of leave both options open and educate that way. And then, some people have done their research too, and they know exactly what they want. I have about half and half. I would say my client list right now is heavy on the Medicare supplement side over the Advantage. What I tell people is, if you're undecided and you don't know and you can't grasp the two, the safest place to start is original Medicare. Because remember, I can get someone over to the Advantage plan later with no health questions asked.
Okay, which actually I think answers the next question about it, was switching between Advantage plans and Part B each year during open enrollment. So you're saying that they would be able to?
Yeah, so you are allowed, each year when you're on Medicare to switch. So I have people that are on the Advantage plan that may want to go back to original Medicare. Well, they can't do that guaranteed issue unless that Advantage plan totally left the market. If that Advantage plan is remaining in play and in the market, then they have to be underwritten to get that supplement. And I have healthcare providers. I just did a presentation with my local hospital, all the case managers and the therapy staff about this very thing, educating them on don't tell somebody in a health event, an episode in the hospital that they should return to Medicare. Because I told them, I can't get them a protective policy of a supplement after they've been in the hospital for a month, so it going back and forth, there are some times where pre-existing conditions come into play. In a nutshell.
Got it. And then kind of moving on to, I know you did talk a little bit about HSAs. There were some questions coming in about HSA. One was, really the difference between FSA and HSA. And maybe if you could talk a little bit about how or if FSA kind of comes into play with Medicare.
FSA does not. Flexible spending account does not. But the HSA is the only thing that is mentioned. And here's what they mention in Medicare.gov. And you can actually go to Medicare.gov and you can look. Medicare.gov is really finicky because you have to know exactly what to search to find your answer. I've played around with this for 9 years. But what it says, because those are tax-free dollars that go in the contributions and everything. So they say in Medicare.gov that you could get a tax penalty. And I'm going to stress that. That's the wording. You could get a tax penalty if you're contributing to an HSA and on any part of Medicare. Okay. They don't say that you will. I have had people in real life that get walked to the door and they've contributed up until the last, and then we have to apply for Medicare. So, I've never had anybody tell me they've gotten a tax penalty, but I always have to just qualify that. They suggest strongly you stop contributing 6 months prior because they backdate Part A.
Got it.
If you don't have Part A.
Yeah, and I think this kind of answers this next question too, is if you do have an HSA but are no longer contributing to it, how does that, work? But since you're not contributing,
if you're no longer contributing to it, you're good to go to apply.
Yeah, perfect. Another question coming in here is, what if you work past 65 and lose your job unexpectedly or decide to retire unexpectedly? Is there a penalty, and do you need to wait until an enrollment period?
So I want to just throw out that whole perception that you've got to throw out and wait till the enrollment period. Okay. The enrollment period every year for Medicare is for people already on Medicare. It's not for people to sign up for the first time. So let's say you lose your job and you walk to the door, you are eligible for Medicare. Well, I did say that Medicare doesn't happen overnight. Yes, I did say that. And that is true. We're not dealing with Amazon Prime here. You can't get it overnight to your door. But you can start that planning process. You can get with an advisor. I'll get you the forms that you need. Let's say if you don't have Part A or Part B, it depends on your situation, whether I'll tell you, just get a hold of an advisor. Say, okay, what do I do next? Because you've got to sign up for Medicare. Remember, if they offer you COBRA, you can be on it for 8 months. So while you're getting your ducks in a row with Medicare, you're still not going to get a penalty for that 8 months. I just say, if I tell my people that work, sometimes I talk to people, they're working past 65 and I don't talk to them until 2 years later when they retire. Okay. They keep my name for that long. And then, but I say, if you get walked to the door, if you decide you've had enough and you leave, call me. I am that first call that day to tell me what you've done so we can get a plan in place. That's how important I think it is.
Yeah. Awesome. And lastly, just a couple more questions here before we wrap up. Some coming in about IRMA. One is, can you appeal the IRMA adjustment if you had high income but now are retired and income has substantially changed?
Very, very good question. So the answer is yes. And every publication that they send you in the mail from Social Security about your IRMAs, they always will have a little section on there if you want to appeal. There is a certain form. I help get that form to my clients, that are in that predicament. They've had high earnings and then poof, it stops because they're retired. Okay, so work stoppage is a qualifying event for an IRMA appeal. I can't promise that everyone's going to win it. You do have to provide proof, but I always say it's worth a try. It's just time, paper, and form. You know, it just takes some time to do it.
Yeah.
But yes, you can appeal it.
Perfect. All right, with that, I think we're going to wrap up. We're coming up to 2 o'clock here. So kind of wrapping this up, I'd like just to thank you, Nicole, for spending time with us today and covering, what could be a complex topic. You've done a wonderful job giving kind of like a thorough and easy to understand overview of Medicare. I would also like to thank everyone for who was able to join us today. We hope you learned a lot and now have a better understanding of Medicare. Again, we will be sending out the replay later this week, so you can feel free to go back and kind of review the presentation. You may also email Nicole directly for any questions about Medicare. And through that QR code, you will have an option to schedule a virtual one-on-one with an SRP advisor. And that could be maybe if you have more general financial questions. With that, I hope everyone has a great rest of their day. And thank you again for joining. And thank you, Nicole.
Thank you for having me. Have a great week.